Hi, Gary. This is Chris Marchack. I'm a prosthodontist in Pasadena, California. I'm the host of Clinical Chats and the co-founder of the I Love Dentistry Study Club. It is a pleasure for me to share another clinical tip with all your listeners. It makes me very happy that these clinical tips help your listeners worldwide. I want to share something today about evaluating occlusal vertical dimension of a patient. Recently, in my office, in 1 week, I had 2 patients see me complaining about their newly fabricated denture. Their reasons were from aesthetics. They could not chew. They could not speak well. Their denture would not stay in their mouth. And they said they just were not comfortable. In evaluating these patients, the very first thing I noticed was that both patients' occlusal vertical dimension was encroached upon, or they were too open. An easy tip to make this diagnosis is to have your patient count from 60 to 70 and see or ask the patient if their teeth are touching while they are counting. They should not. There are multiple ways to evaluate occlusal vertical dimension. 1, closest speaking space. This is the technique I just described. Having the patient count from 60 to 70, and the patient's teeth should come very close to touching, but does not touch. 2, M sounds. Have the patient repeat or say the letter M. I actually have my patients hum the letter M. M. When they say the letter M, the patient's lips touch, but their teeth do not touch. This gives the resting position, and there should be room from the resting position to the maximum intercuspation position to touch. In general, Class 1 patients typically need 1 to 2 millimeters from the resting position to the maximum intercuspation position. Class 3 patients can have between 0.5 millimeter to 1 millimeter. And Class 2 patients typically need 2 millimeters or more to function with speech and swallowing. A third technique is to have the patient swallow. Can they swallow? Or is it difficult for them? You will notice it is very difficult to swallow with your mouth open. If you are not able to create a seal with your lips, you cannot swallow. These are just a few techniques in evaluating occlusal vertical dimension that are documented in the dental literature. Also, remember, the evaluation of occlusal vertical dimension is not only for edentulous patients, but also these tips can be used with patients who are dentate. Gary, I hope this helps your listeners as it has helped me in my practice and treating my patients. Gary, I also want to share a special offer that has been given to me to give to your listeners. If they want to join the ILD Study Club and to participate in an incredible new way of learning, they can use this special code, CMSC2021, and they will receive 50% off their yearly study club subscription, which goes from $199 down to $99. They can follow the link to ildstudyclub.com to join. Hey, Gary, thank you so much for having me on the Thriving Dentist Show. I wish you and your listeners all well. Thank you so much.